A very good morning. We're glad you're still watching Morning at NTV. If you are just joining us, welcome on board the premier morning show in the land. I'm Chris Higenyi, and we are taking note. Taking note of what? Mental health. It's Mental Health Awareness Week, the 9th of May to the 15th of May, where stakeholders, including advocates, psychiatrists, and including you, the average Ugandan, pay attention to the issues that affect your own mental health. Now, most of us, when we hear the word mental health, we are quick to stigmatize even ourselves to think it's about being mad. No, it's not about being mad. Mental health is the ability to be in tandem with your mental faculties. It includes avoiding stress. Now, the theme for this particular Mental Health Awareness Week is loneliness. I do not know why it was chosen, but it is the reason officials are here to speak to us. Miss Jerry Opoka, many thanks for joining us this morning.
It's my pleasure.
And many thanks to you to Evelyn Karono.
Thank you.
From Makerere University.
University and Uganda Counseling Association.
Uganda Counseling Association. No doubt we need counseling as Ugandans to be able to go through the stresses of the day. First and foremost, let me have an idea about what Mental Health Awareness Week entails, if you will take the honors first.
So May, in the month of May, we bring mental health to the forefront, or mental wellness to the forefront, just so that people can pay special attention to it for a condition that is hidden in the background, that is very highly stigmatized. It's really important that we are able to speak about it and have positive, information about it, so that we start to, when we have more conversation, we reduce the stigma, and then people can have their treatment sooner than later. Of course, I know there's a lot going on, especially within the environs of the stakeholders who are ensuring that people, at least who are grappling with issues regarding mental health, can adopt. First, give us the picture of where we are as a country. For example, we know for cancers, we know the number of people that are grappling with cancer, we know the number of people grappling with certain diseases. Do we know the number of Ugandans who are mentally challenged? Before we went into COVID, 2019, we had about 35% of the population suffering from mental illness, known mental illness. And normally by the time we are critical. That is normally when we go to hospital. So 35%, which translates to about 28 million Ugandans. Ugandans. Think about it. If these 28 million Ugandans. 28 million Ugandans known. Yes. Sorry, that's 14 million. But 14 million Ugandans known. If each of these people knows at least two people who's close to them, mother, father, mother, brother, wife, husband, or a child, if only two people are close to these 14 million, that means another 28 million people are directly affected by mental health. Add 28 directly affected to the 14 who are actually known to be suffering before COVID. That means we are at about 42 million and out of a population of 44. Directly affected by mental health issues. And the amount of stress that COVID occasioned upon the nation and the world at large means the situation right now is grim. It's appalling. It is.
Yes. Madam Evelyn Karono, you are doing a lot of work. We're at the association, and of course I'm sure this is one of the issues that you are grappling with. Before you take us through the association and exactly what is your take on what is no doubt a very bad situation?
Like she has just said, the truth is I think COVID only made things worse, but otherwise we've already, because this is a low income earning country, first of all, because poverty is one of the things that even makes mental health worse, especially things to do with depression. And in Uganda, depression is on the high because you can hear of the suicides currently, both young people, middle-aged, So generally speaking, we are really, really grappling with a lot of suicidal kind right now as a country.
So what is the mandate of the association, and how are you guys rolling out initiatives to ensure that people deal with this particular spectre?
Yes, as the Uganda Counselling Association, we regulate counsellors in the country, but also it is a center. It's like where you can get every kind of counsellor that you want, that handles what children, old people, adolescents, family counseling, all that. But also as an association, we are also doing a lot of sensitization. So like there's a mental health week, but for us it's a whole month. It's a mental health month. And actually as Uganda Counselling Association, we'll be having a mental health conference for 3 days from 25th to 27th of May, this very month. And the theme is making mental health a priority, a national priority. So meaning that, yes, if the government has been doing something, we need to do more, because mental health has been so much at the lower side of physical health. Okay. Yeah, even when you compare the budgeting, mental health is given like 1%, you know. And the truth is, most of the physical illnesses are being they come from the mental
manifestation of
from
mental.
Okay, very shortly, you'll be taking us through therapy for mental health. But before you do that, I would like to come back to Madam Jerry Opoka. How does mental health how do mental health challenges manifest? How do I know I'm grappling with these things?
So that's a really good question. And in our organization of Soul Foundation, we have been working with, we've been dancing really with Butabika Hospital patients. And
that's interesting.
And yes, it really gave us a unique perspective into mental health, in the sense that we came in as people who have not suffered a mental health problem into a space where people have been acutely ill and they're in hospital. But so between them and us, we looked at the whole spectrum of the conditions that someone may have. And we realized that there's a very thin line between, just going through everyday stress and actually being unwell mentally. So how you know that you are not okay? Again, we have carried so much stress for so long that we think life is supposed to be like that. But how you know that it's now getting out of hand is when it starts to affect your daily activities, when you do not feel motivated to go to work, when you do not feel like you want to be out with people, when you force yourself sometimes to go out, you think you're having fun, you come back home and immediately you're feeling sad again, you're feeling anxious, when your fear of whatever it is now debilitating. That's when you know. And normally we would know. The thing is that we explain it away. We explain it for so many reasons. The people around us, when we talk to them, they'll say, oh, no, don't worry. You know what? I also have issues. Let me tell you mine. And immediately you're like, oh, theirs is worse than mine, so let me.
So when somebody says, for example, you tell them about something and they say, hey, come on, we all have problems. Is that kind of wishing it away, or completely dismissing what could be somebody sharing a pointer to a very, very tight situation they could be in? Should we pay more attention when somebody tells you, I'm in trouble, and then we shouldn't just tell them, come on, that's where we are all, We should be more caring.
Yeah, for a layman, usually when someone says, I have a problem, you might even jump and say, man, I also have problems. By the time they say, okay, I'm not sleeping well, you'll also say, I think even me, I'm not sleeping well. So sometimes this person needs a therapeutic talk, okay? And sometimes people only want to be listened to. They're not looking for solutions. They're not looking for those answers from you, but then they want someone who's going to listen to them non-judgmentally. So sometimes when someone says, I have problems, it's an eye-opener. They want to share, but then they are waiting for an environment that will allow them to share without being judged and without being interrupted. So, well, for starters, it's good to speak out. I'm not feeling well. If you're a person who has not done maybe counseling or psychology, start by listening and say, okay, how can I help? Okay, so that you kind of give that person attention than saying, I'm also feeling the same.
That's
And
right.
if you feel this person's issue is really beyond you, you can refer the person and say, we have counselors. You can go to either a clinic or a hospital, but now we also have a center where we can get counselors that we need. Our offices at UHMG for the association.
Okay.
Yeah, someone can say, okay, let me call someone who can speak to you therapeutically. Now that's the
Therapeutically.
difference with the therapeutic talk. It's
Wow.
not just a talk.
Not just coming and talking at me
No.
and telling
No,
me
no.
how I'm failing to deal with problems,
No.
how I've been irresponsible.
No,
You know,
it's
that
very
kind of takes things a little bit, it's more like it makes things worse.
Yes, because the person goes back even worse and more hurt.
Yeah.
You know, you've had people, you begin speaking and then they interrupt you.
Yes.
They keep telling you that, no, but even me, but if that's small, you know. The person will go feeling worse, and
Well,
usually they learn to keep quiet. They don't share again
They don't
because they
share
feel
again.
when I want to share, I'll be interrupted.
Now, that
So-
takes us into exactly the theme for the Mental Awareness Week. When
Yes.
people do not share whatever they are going through, they are grappling with a form of loneliness
Yes.
that some seem comfortable,
Yes.
but clearly they are not comfortable. They need help. This loneliness, everyone deals with it
Exactly.
their own way. However, as professionals or counselors who are dealing with the people who have manifested these challenges, how do we go about loneliness from all angles? Could be relationship loneliness, could be family loneliness, could be loneliness at work. It also manifests. People are finding trouble blending into the
Yes.
community in which they are. How do they go about fighting loneliness?
The thing is, loneliness is different from the physical loneliness. You know, physical loneliness is different. I'm alone. I wish someone was here and we talk. But then the psychological loneliness is a mental health problem.
Yeah.
It means that even when you're in the house, your family, you're staying with people, you're 10 people in the house, but you feel you're alone. So that is psychological loneliness, and it's a mental health issue.
That's right.
And it, at least if we make an assessment of such a person, either the person has stress that has been going on but not worked on, maybe it's going into depressive thoughts, you know, or maybe generally there's something that is underlying. And during COVID, I think we witnessed the highest numbers of loneliness. People would post on social media,
Yeah.
you know, showing a picture that, you know, I'm here, but I'm alone. Yet children, they're in the
Children
family.
there,
Yes.
Yeah, I had
spouses are
children who
there.
called me.
Yes.
They called, I don't know where they got my number, but I think from the monitor at one point. And a girl called me.
Monitor
under the-
must have done a good job by trying to ensure that
Yes.
they know who the counselor
And
is.
she was
out
under the
there.
bed and said, I'm under the bed. I'm here, but I'm not happy. I said, why?
Oh.
Because my parents don't want to listen to me. So this child used to call me and cry over the phone. So people who are lonely need to be assessed.
Okay.
What is making them feel they are lonely? There's something that is underlying that maybe is not worked on. Especially, there could be daily stressors that have now accumulated, and it's now kind of a chronic stress, and they feel, I'm alone. I think Philip Tyre said, alone and frightened.
Alone
like
and
there's
frightened.
no one out there
That's right.
willing. But usually there are people willing to listen, only that people don't know where
Yeah.
to go.
Ms. Opoka, how do people deal with the fright of loneliness? What do I do? Who do I go to? Do I seek professional services, or it is better to speak to somebody I trust who might not be listening sometimes, but I should be able to make them listen, and then I share my problems?
So first of all, one of our main goals at Soul Foundation is to bridge the gap between people who are struggling and the mental health practitioners.
That's right.
Because we are not yet at that place as a society, as a community, as a people, where we know that when I'm feeling a certain way, or when I notice somebody that I love is not coming out of their room anymore, they don't want to eat, they don't want to bathe, they do all these things. The first thought is never to find a professional. The first thought is to discuss among the family, maybe talk to one auntie, maybe go to church, and, you know, with all due respect,
Self-medication,
self-medication,
taking some
you
alcohol.
know, yes, try all kinds of things, but we need to be cognizant of the fact that there are people out there who have gone to school for years to
help
study
you.
the mind, and
Okay.
they know how to unravel. And again, in fairness to the people around them who, you know, they try to talk to, people almost want to snap their fingers so that their loved ones get better.
Ah, sure.
And because I don't know how to help you, I will try and almost shake you into saying, just don't think about it, you know, just...
Which is also
yes, just
a bad
stop. And then the person just goes and gets into the lonely space.
All right, we're glad that the Mental Health Awareness Week is on. There's a lot that's going to be going on. Just your parting word and exactly how you're going to be blending these activities and helping people deal with the aspects of loneliness in not more than 30 seconds.
Yes, one would love to encourage the public out there to seek for help from the right places. At least if you're not able to walk to our offices at the Uganda Counseling Association, even when you go to a hospital, they know you can say, I want to see a counselor. Yeah. The hospital will connect you and say, okay, this is where you meet a counselor if you want one.
Parting word?
Mine is to say, whatever we struggle with in the mind is very normal. It's, if you have a mind, it's bound to get into some form of stress. Let us not be shy. Let us not be ashamed. Let us come out and speak to the right people and live a productive and positive, good life.
Ladies, many thanks for the very insightful perspective on mental health. I'm sure people out there should be able to now make out exactly how you deal with this particular problem. It's not a challenge that is out of hand. It's something that you can be able to address by speaking to people. But most importantly, avoid self-medication. There are people I know, when they get lonely, when they get depressed, they go on a alcohol consumption spree. That is not the best thing you should do. Evelyn Karona from the Uganda Counseling Association, many thanks for joining us this morning. And many thanks to you too, Jerry Opoka, a mental health advocate, for giving us those very insightful perspectives. Here on Morning at NTV, we hope the information that you get is able to help you make decisions the best possible way. However, do not feel shy to talk about the challenges that you're going through. You are human and you are vulnerable.